If you are dealing with pain in the hands, wrist, elbow, shoulder, it is highly likely that the solution to your discomfort resides in some good old-fashioned rolling out of this entire chain. That's what this video and the next two in this series are all about, rolling out the shoulder, upper arm, and then hands and forearms. Let's get into it. Okay, we're gonna be releasing the upper body. Luckily, you only really need a lacrosse ball to get some really awesome release for a lot of the muscles in your upper body. The way this is gonna work is you're gonna watch me release one muscle, see how I do it, then pause the video, go get it on your own until you feel like you've spent enough time on it, usually about 5-6 minutes, it depends on the muscle, and then you go back to the video, hit play, see the next muscle, repeat the process till you've gotten all your spots. Some muscles will feel very much in need of the care and time, take more time with them. If a muscle is just not that sore, move on. Cool? So we're gonna start with the pecs. Sitting at the chair, at the computer, driving, these will get stuck tight and they'll get stuck toward the middle of your chest, the sternum. So you're gonna take your ball and you're gonna find a wall. At home, I want you to find the corner of a wall so you can have your head here. But for this video, I'm not in a big enough office yet. We're gonna use this for the purpose of video. So you're gonna lean in the wall. This is your sternum. You're gonna slowly just work your way down the sternum, leaning into the wall. Now, I'm laying on the ball, but my body's actually angled a little bit so that I can scoop the tissue off. It's not just about going right onto the bone. It's about using the ball to scoop tissue off. So I'm gonna hang out right here. And breathe. I'm gonna move faster than you are because you're gonna pause the video. So I'm here at the top and it feels actually really good. I would like to stay here longer. And I'm gonna slowly just bring the ball a little bit lower once that spot has let go. Slowly bring the ball a little bit lower once that spot has let go. I just used my hand. I could very easily just move my body. So I've done all this area, then I'm going to start coming out to the sides a little bit. I'm just coloring inside the lines and sometimes outside the lines as well. So again, it's just right here. Breathing. Breathing. As you get to the outside of the pec, you can lay on the wall and again, really use it to peel this tissue off. So I'm just laying on the tissue here, really peeling it off. Bringing it down, getting the entire area. Right here. So you've got pec major, which comes across and is this big muscle. Then you also have pec minor, which attaches on this little bony outcropping and comes into the side. So the top layer sometimes gets stuck to the layer underneath. So you can use the ball again, coming from the side, to peel the top pec off the bottom pec. And again here. And again, you're just tracing out the muscle, going really slow. Pausing on the spots that hurt. And that is the pec in a nutshell. We got all this area here. We're now going to go on to the serratus, which we will talk about a lot in our work together. Serratus, obliques a little bit. And it's very simple. Again, you would find the corner of a wall so that you have room. But for the video, we'll be over here. And I'm just going to let this work all along here. You can move around to find the spots to maybe warm the tissue up. Like in all of life, not every rule will be applicable all the time. But I'm just following around. Notice how I'm turning my body, right? Effective massage and self-massage, it's always a matter of two things: where you are and the angle that you're getting that particular spot. In certain areas, you'll be on one spot, but you'll change the angle of the same spot 3 times, 4 times before you're done. Slowly rolling my body. I'm mostly on the same spot here, and I'm just turning my body, coming around looking for the spots that are sore. If you may, often it's a good practice, especially on the ribs, to practice breathing with expansion of the ribs. So to help spread the ribs, to help that ball get a little deeper. So we just got all this side here. We're now going to work our way up to the back. We're going to get all the erectors and traps, basically just all of your back. So I'm putting the ball right here in the middle to start, right between the spine and the right shoulder blade, about right there. And again, for you, you're going to let your body, the intuitive wisdom of your body, tell you where to go. Certain areas will feel great, certain areas you won't feel much. Right now, if you look at my feet, go ahead and show my feet. I'm just leaning on the wall, right? Leaning on the wall. If I need to, I can fall down a little bit. Some of you may want to be like this. Switch legs. It doesn't, but typically you want to find a way where you can be as relaxed as possible in the legs and just be over here. If at any point you're not enjoying the wall and it's too hard to get the pressure you need or control the pressure, just lay on the ground. Grab a ball, lay on the ground, and do the same thing. Put it in those spots. And now you basically can just lay on it and control the pressure that way. And it can be a much easier solution. Not every spot is ideal on the floor. Not every spot is ideal on the wall. So I was getting all up and down here. At home, you may feel like, oh, I want to keep going down all the way into my hips. That's fine. For this video, we're just going to bring you up here. But once you understand these spots, you're just going to listen to your body and let it tell you where to go. So I'm coming up on the neck now, right here, pretty high up. Some spots you will have a gradual movement. You won't stay on it the whole time in one spot, freezing. Sometimes you will do some tiny micro movements, and that's okay. For the next spot, you will find a corner wall. You're just going to put it right here. The wall is right here. You're just going to lean on the wall. As I'm bent over here, I'm sticking my butt out, just making sure that I'm using the hamstrings and not doing this. To the best of your ability, really sit back in those hamstrings. And then I'm just pressing into the wall. I can take my other hand and put it on my knee for support. And I'm just holding that, breathing, looking for spots. Awesome. Last but not least, we're just going to start coming off the back onto the deltoids right here. That's going to feel nice. Kind of right here. Again, I'm just right here behind my shoulder. Moving around. This feels to me good, just moving around a little bit. If I find a soreness spot, I will pause on it. Getting the deltoid here, right? Right now I'm behind the deltoid, starting to come on the side of the big shoulder muscle. Now I'm leaning in, putting weight on it. The great thing is that your body will guide you. You just have to give it the chance.